Chronic headache. Well, today's not chronic headache. It's just a headache today, and that's why I have the ibuprofen now. I thought people would be interested. What do doctors actually take when they have a headache? Well, I'll show you here in a moment. Oh, and thank you for the hearts, by the way. I always love having those. Yeah, chronic headaches and acute headaches, I kind of view them as two different kinds of disorders, even though it's the same process going on causing the same type of pain. We're now attributing it to dilation of blood vessels, and then that dilation is causing stretching in the walls, and there's receptors, little nerves inside the blood vessels. These are blood vessels inside of the, either in the brain itself or in the scalp. It can be either, depending on the type of headache. And that stretch is interpreted as a pain. Now, what causes this? All sorts of different things. You can have tension headaches, you can have vascular headaches, and generally they come from one of those two types of headaches. Oh, and we also have Dialis 5214. We're glad to have you too. A lot of people have numbers in their handles on Twitter. Just made that observation. So the tension headaches, of course, come from muscle tension, usually come on later in the workday, and if you can just relax, generally they'll go away and you won't have to use medicine for them, hopefully. Vascular headaches can come from any number of different triggers that can occur. I believe what I have going on right now is probably a combination of the two. And if you catch headaches early, you have a better chance of knocking them out than if you wait. And so that's why, even though it's not a horrible headache, I'm not doubled over and throwing up. No, it's just kind of annoying. It's there. If you catch them early, you have a better chance of getting rid of them than if you let them sit around. Oh, somebody asked, is it true that blueberries as well as raspberries help to avoid heart attacks, doctor? Well, I tell you, if somebody's going to have a heart attack, and taking the raspberries and blueberries is not going to keep it from happening, but it may play a role. So what we'll go ahead and do here is exactly what I planned on. I'm opening up the bottle of generic ibuprofen. Yes, the doctor uses the generic. And okay, these are 200 milligram each. And you'll notice I took out two. Boy, I really can't hold the camera, can I? For a total of, oh, look at that, Leanne joined us, Cynthia Leanne 3. We're glad to have you be a part of things too. For a total of 400 milligrams of ibuprofen. Again, I'll show you. It's just some generic bottle. I don't even know what store this comes from. This one's called Top Care. Leanne, you remember where you got Top Care ibuprofen from?
Probably CVS.
Probably a CVS, so there it is. Interesting thing about CVS, those are the same ones I use too. Oh, and does your medicine cabinet have too many things in it so they fall down when you put things away? There we go. Okay. Yeah, I was going to talk about different stores. Try not to use them that often, but they work great. Yes. So, ibuprofen seems to be, yes, hi Cynthia, Leanne. We're glad to have you. We're also glad to have Melpin 1. Someone told you vitamin from GNC is good. Multivitamin from GNC. You know what? It's probably no better than multivitamin from anywhere else. Melchem 1 is vitamin to follow, and can a chiropractor help with headache? Probably somehow. Chiropractors and headaches, they're probably going to be working around the upper spine, and the only studies I can see in respectable medical literature about chiropractic and the upper spine is the cases of causing vertebral artery aneurysm. The vertebral artery actually goes through the upper vertebrae of the spine, and it's on both sides. It's paired, and then they come together to form the basilar artery as it comes up to the back portion of the brain. Carotids cover the front, basilar artery covers the back of the brain. The vertebral arteries, as they're coming up, as chiropractic practitioners are doing maneuvers on their manipulation of the neck, the upper spine, they have a way of actually causing aneurysms in these arteries. They have killed people. My partner, Dr. Vaughan, has actually been a part of a case at a hospital up in Reading where it was indeed a vertebral aneurysm caused by chiropractic manipulation that caused I believe it was a stroke in that case. I don't know that there was a death necessarily. So no, I do not recommend, oh, Chicktastic GR, we're glad to have you back. I don't know that I would recommend them working on the upper spine for headache. If they're able to work on the lower spine and help your headaches, great. Not sure how that would work, but, oh, and Big Red Z06, we're glad oh, because that's a type of Corvette. Thank you for joining us. I remember that from last time you were part of this. So here I go, the 2 ibuprofen. Hello. Now, yes, full glass of water because ibuprofen can be hard on your stomach. And I just had lunch, so I've already got food on my stomach. We want you to have food and water in your stomach when you're taking something like ibuprofen. Ibuprofen can be dangerous. It can be hard on the kidneys. It can even cause kidney failure. It can cause ulcers. These are very, very bad things it can do. But yet, despite knowing that and having knowledge of a long list of potential adverse reactions, I'm purposely putting this in my body. Why am I doing it? Because I'm doing it in as safe a way as I know how. And the risk is present but small and manageable and worth the benefit of potentially getting rid of this headache for this afternoon, even though it's not that bad just yet. Migraines from MSG and yeah, all sorts of things can trigger them. Nitrates and MSG and flashing lights. Ibuprofen hurting the bladder. That one, I don't know specifically an injury to the bladder, although it can hurt so many different organs, I would not doubt it. Yeah, I don't know about the bladder. That may come from somebody having heard that it hurts kidneys, and a lot of people somehow connect kidneys with bladders, and so that could be where that comes from. Doesn't help my headaches at all. I take Relpex or Sumatriptan. Okay, and of course you're a person who suffers from chronic headaches, so we're talking about something different there. My mom has migraines, almost half of them. Oh my goodness, that's awful. She says from MSG. Wow, you'd think if that was the case, she'd stop doing the MSG. Like I said, full glass of water. That's why I keep going back to it. Thank you for the hearts, by the way. Yeah, Missy was talking about the triptans that are excellent medicines that work on the action of serotonin on the blood vessels to help get rid of migraine. And again, that is truly an abortive medicine. Abortive meaning you abort it before it becomes a full-blown migraine to help it to keep from doing that. And they work excellent. Tips for swallowing big tablets. That's a hard one. Drinking lots of water with them, trying as hard as you can to get them back in the mouth, to let the tablets just flow with the drink as you're swallowing. But it's hard to get over that reflex of holding them back if you're one of those people that has a trouble with the big tablets. If you can, breaking them in half. Of course, that's not always something you can do. People who get these time-released medicines, certain capsules that are 24-hour, that usually would be just 12-hour, there's a coating that you don't want to get rid of by breaking them, so you need to make sure they can be broken. She's been able to stop them only a week and a month or so by changing diet. How does caffeine help headaches, or will it? Yes, it will, Big Red 06. I have a headache diary about 18 to 20 days a month now. Really tough. That is awful. Any other advice, though? It seems like she's allergic to all food. Yeah, that's something she's going to work out with her doctor rather than on this Periscope. But, caffeine, yes. I will sometimes use caffeine together with ibuprofen if I'm really, really feeling sick, because it will augment the effect of the ibuprofen and help to get better relief. She needs to go to the doctor. Yeah, if you're having that much trouble, you need to maybe even work with a neurologist possibly. Big Red 06, yes. The Sprig 52, we're glad to have you be a part of things. Thanks for all those hearts, you guys. That's very nice. This is a physiatrist is more efficient than a chiropractor. Two different things. Physiatrist, you're referring to somebody who's done a residency in physical medicine rehabilitation. This is a doctor who specializes in musculoskeletal pain, medical doctor. This residency actually was brand new when I got out of medical school in the mid-90s. And they could possibly help for headaches. Yeah, absolutely. Or a physical therapist. Either one. I would certainly try that if the headaches are coming from muscle tension, the way a person holds their posture, that potentially could be relieved by the physiatry attention. Also, certain aspects of vascular could too, although mainly it's going to be coming from something having, if they help, it's going to be coming from something having to do with the way you hold your body. Okay, more hearts too. What did I want to do today? In addition to talking about the headaches and showing you guys I use a couple ibuprofen when I have a headache and try to catch it early, I wanted to let you know that we do have some things coming up. If you're not already a subscriber to the Auburn Medical Group YouTube channel, I'd encourage you to do that because that's where a lot of this is going. We do try to put our Periscopes there, kind of the best of. Not all of them make it there, but the good ones, when there's a real healthy discussion, I'll try to put those up on YouTube. And of course, if you're subscribed to YouTube, then you don't miss them. Whereas on Periscope, if you're not on Periscope at the time, you'll miss the live Periscope, or a day later it's gone. Whereas if you, oh, Fate, I recognize that too. You've been a part of things. Thanks for joining. But if you are subscribed to the Auburn Medical Group YouTube channel, then you won't miss all of the shows. There might be something that you'd be really interested in that you want to make sure you catch. So be sure to do that, and tell all of your friends too to subscribe, share it with them too. We've been getting a lot of attention on YouTube. I was kind of blown away this last couple weeks when I found that a video of, which one was it? It was an ear irrigation, had 100,000 views. That was, you know, I'd never had that many views on a YouTube video before, and that was kind of surprising to me. So I started looking at it and realizing that people are really watching these Ask Dr. Vaughan videos. And so we're going to be doing a little bit more with that. Along with that is, as we go into the new building, we will have one room for a studio for doing what we're doing right now. We'll probably record on a different camera to put on YouTube, but still use my Periscope community, you guys, for generating the questions and the conversation, because it's just better when you have two-way communication. And we have Dios 5214 joining us right now. We'll also have an exam room, a rather large exam room, larger than any of them we have currently at the Auburn Medical Group, for making videos, for having room to have the camera and to have it well lit for procedures or interactions with patients that the patients don't mind sharing. They give consent for it, and that other people would find interesting or want to participate in the discussion. That will be something that will be very interesting to pull off. So I hope that you guys will be a part of that. So do, if you're not already following this, if you're new, do follow this. Son just had an appendectomy, sent home told to take ibuprofen. Is this normal? Absolutely. A lot of times with surgery, you have this hesitation to use anti-inflammatory medicines like ibuprofen, because it is a bit of a blood thinner, but a certain amount of time after an operation, you're going to be fine using that. And it's more an issue of before rather than after. So you'll see surgeons do that. So, I hate to go off all of those hearts there, but we'll go ahead and get off for now so that we can plan for even bigger and better videos in the future. So until then, this is Dr. Mark Vaughan telling all of you wonderful folks on Periscope, and if anybody's watching this on YouTube, to be sure to subscribe and stay in good health.